Hi, Dr. Scott Freed, the doctor in the house. Here to talk to you today a little bit about arthritis, tendonitis, carpal tunnel, problems at the hand and wrist, and all the way up to the elbow. For those of you who don't know me, I'm an orthopedic hand surgeon. I am board certified, and I've been in practice for over 25 years, taking care of patients who have these type problems. And something I found early on was that many patients don't need surgery. Now that sounds strange coming from a surgeon, I know, but I found over the course of time, pairing and working with our therapists, using splints and devices to rest the hand and wrist, but the proper type, not ones that put them in the wrong position, such as the cock-up splints, or ones that rigidly held a hand and an arm, causing people to use this abnormally, but rather splints and therapies that calm down inflammation often gave the same, if not better, results than the surgeries we did. And as a subspecialist, I see many other people's problems. I see patients who've had surgery, and they come to me and say, what can I do at this point? I still have my pain, I still have my numbness and tingling, my hand still wakes me at night and I have to shake it out. What can I do to help that? Well, the first thing I do with any patient when I see them is talk to them a little bit about why they have symptoms, what the underlying problem was that brought them to this place where they were uncomfortable, in pain, and unable to function. And the bottom line is that if you have inflammation or swelling inside the carpal tunnel, in this area where the tendons, the cables that move your fingers come through, this closed tunnel and space can become an agitating point for the carpal tunnel median nerve. And this nerve is large. It's the size of a pen. And it runs straight down here and into the fingers, coming to the thumb, index, long, and this side of the ring finger. And that nerve cable actually goes up the arm, all the way up the arm to the neck. And many patients who have these nerve problems complain of pain and discomfort going all the way up here, and sometimes neck pain and radiating down here, which is the subject of another discussion. But if you happen to be one of those people, you may want to consider evaluation for problems like a disc problem in the neck, or a problem with the nerves between the neck and shoulder in the brachial plexus or thoracic outlet area. But these nerves start here at the neck, and they travel down as the long cable and the median nerve here, down through here into the hand and wrist. The other major nerve that sometimes is a problem is the radial nerve coming down this way, back in this area in the back of the arm, and then down to the back of the hand and wrist. The radial nerve goes across the tennis elbow area. So many people who have tennis elbow problems or pain in the elbow and forearm actually can have a nerve and tendonitis problem. But these can be treated if we calm down this inflammation and the swelling. I'd like to take a moment or two to talk to you about ultrasound anatomy, so you can understand what the body looks like inside. Using ultrasound, the same type ultrasound that you would use to see a baby, except a finer probe, basically one which shows us much more detail, allows me to look at my patients inside and see their anatomy. So if we look over here, the fingers would be down here, the upper part of the wrist here, and this is a view from the palm looking this way onto the carpal tunnel and in this area. And so what we're seeing going in this direction is the median nerve on the left-hand screen. So over here we have a median nerve, and this is the nerve itself, this dark tube. And down here are those flexor tendons, the cables that move the fingers. Up here on top is where the ligament is, and that presses or compresses the nerve. And this white you see around the nerve is scar tissue. This is the scar tissue that is formed around this nerve, and this is a very scarred median nerve. And down in here you see the dark and light streaking. This is a lot of tendonitis. On a transverse view, the other view off here to the right, this is if I took the wrist and cut the wrist off and we're looking end on into the wrist. Obviously I don't cut people's wrists off, but if we did, we would see here and up top here on the palm is where the ligament is. This is that median nerve, and these are those flexor tendons, the cables that move the fingers. So you're looking and seeing how they can move back and forth inside there. But what is here also to note is this dark, all this dark in here. That is tendonitis. That's inflammation or swelling about these tendons. The lining around these tendons has become swollen, and it continues to press on this median nerve. Now, in looking at this anatomy again on the left, you see that median nerve. You see the long view here, that same median nerve. And over here on the right, I want to show you what happens every time someone makes a fist or does fingering or movement activities. Watch what happens to that nerve. You see how the nerve in this normal study can move around freely. It pops back and forth around and between the tendons, sliding under the ligament. This is relatively normal motion in a median nerve and a carpal tunnel median nerve. If we have a nerve that is scarred down and it is bound down, then we see a very different picture. Now, on a long view, we see what happens after the scar is there. Watch what happens on this median nerve on the right-hand side. You see how when the fist is made, it disappears. Watch again. As the fist comes, that disappears and then comes back. One more time. The hand is open, the nerve is okay. You can see it here. When the hand makes a fist, close, nerve is gone, open, the nerve comes back. So every time this patient makes a fist, it completely compresses that nerve, and that scarring around the nerve doesn't let it get out of the way. This is when we have carpal tunnel. This is what we need to protect against. When we have this swelling in the carpal tunnel, it continues to put pressure on the nerve and the median nerve in the carpal tunnel. That pressure sequentially over the course of time causes scarring around the nerve. Once the nerve becomes scarred or bound down, the normal fascia, the normal soft tissue around the nerve, can become thickened and bind the nerve down. If you think of fascia that surrounds these nerves as a fine cobweb-like structure, and it allows these nerves to slide or move in between the muscles and tissues all the way up the arm when we do activities. But when it becomes torn or inflamed or pressured on a chronic basis, from keying, chronically typing, chronic wrist positions, pounding on it, maybe a job where you're repeatedly performing activities and moving, this tendonitis puts pressure on the nerve, and that scar becomes thicker, almost like someone poured rubber cement around the nerve. And now when you try to reach or do this or bend your wrist back and forth to the extremes, that nerve is stuck, and that scar tissue pulls on the nerve. It squeezes the nerve, and nerves don't like that. And so what happens? The patient experiences numbness, tingling, pain, radiating pain, aching, and sometimes in the late stages, even loss of muscle function. But most don't get to that stage. Most people stop these activities either because they can't do them anymore, or people who try to push through it often end up in my office. So the first thing we talk about is education. If you understand that keying and doing this kind of typing in an abnormal position or using a mouse with that wrist cocked back up is putting pressure on that nerve, sometimes just changing the way you do it, or taking a break, or doing stretches and exercises, which we call nerve slides or stretches, to open up that tissue around the nerves, will be helpful. Therapy for what we call modalities, deep heat, ultrasound, high volt stimulation, TENS units, things that calm down inflammation, calm down irritability, often leaking medication around the nerve, not injections, but just leaking medicines which are anti-inflammatory in nature to calm down inflammation. And there are multiple sources of these, everything from flaxseed oil to other anti-inflammatory medications which can be placed in this area to calm down this irritation and swelling. And a splint, an appropriate dynamic splint. Dynamic healing is very different than immobilizing something. Rigid splints which hold the arm, hand, and forearm in a rigid position often are a double-edged sword because you're working against them, trying to do things, and then you have to use the elbow more or the upper arm more, and before you know it, you're agitating the whole arm and you've got pain all up and down the arm. And then that becomes a whole nother issue because trying to function in an abnormal way. Plus, the body likes to move. If the wrist and hand can't move at all, the healing can't occur in a more natural way. So, over the course of the years, we developed splints or braces and ultimately started making these braces in a different way so that we could get them to people who didn't live in our area and I couldn't get them to. We would have people flying in from across the country just to try our program rather than have more surgery, especially repeat surgeries. We came up with a splint, a device. It's called the Miracle Splint. And this device is unique as compared to other splints. It looks like a splint, it looks like a wrist brace, yes. And it indeed fits the hand and wrist like a wrist brace. The hand simply slides in, these straps snug nicely. And then the hand and wrist are taken care of. They're calmed. They're given heat and a massage by the way the materials go, so that when the hand and wrist are moved, and again, you can move the hand and wrist in this splint, you can move your fingers, you can do that, but you are supported here in a wrist neutral position, not cocked back up. That allows healing, it allows comfort, it takes the pressure off in this area. At nighttime is a very important time to wear it. It gives you 8 hours, if you still sleep 8 hours at night, of resting this hand and wrist, calming down that tendonitis and inflammation, and often can give enough relief just in of itself. And there is something else unique about this. See, this device has inside of it special pieces. This is orthoplastic type of special medical grade plastic you can see here. And it comes right inside the splint and it's flexible. But even more than that, it's moldable. So this piece of orthoplast sits here in this pocket. The whole splint goes in the microwave for 60 seconds. Then you take it out and put the splint on, and it molds to your hand. These orthoplast pieces mold directly to your anatomy to give you a different type of healing, a calmer healing that fits you, specifically your anatomy. And this can be as rigid or as loose as you want over the course of your healing. But then once this is on and you're resting, you can come in and out any time during the day, but you have this ability to do this. It takes pressure off here. If you have tennis elbow or radial nerve problems in here, that can calm this down as well. I don't operate on tennis elbow problems. Tennis elbow is a problem that is generally curable. In fact, very, very few patients need surgery here. And the surgery is highly unpredictable. Once we calm down the inflammation here, and here if it's the radial nerve as well as the tendons that insert at the end of your elbow, the problem gets better. It takes a long time to get better. Don't expect it to happen in days and weeks. It can be months because this needs to form nice scar and rebind down in that area. So if you have a tennis elbow problem or a radial nerve problem, along with the carpal tunnel, it's a way to heal. But it's certainly better than surgery, without any risks, without the complications of surgery, possible nerve damage, possible worsening, possible increased scar around the nerve. And once you've had surgery, you can't take it back. It's there, it's done. The concept here is calm down inflammation, calm down swelling, calm down your discomfort by taking care of you, modifying your activities, taking breaks between your typing sessions, stretches, opening up. Use dictation. Don't type as much. Don't key as much. Don't thumb text, because pinching, gripping activities all aggravate the median nerve, the carpal tunnel, the tendonitis. So take the time to understand, to take care of you, and I can help you heal many times without surgery. Thanks for listening, and stay a regular. We'll keep these videos coming. Great talking to you today.